Welcome to the team, everyone. We're glad to have you here. My name is Beth Grigg, and I'm the Director of Residential Health Services. I'll be spending the next half an hour or so with you. I can be found at Residential Health Services at Wyndemere Independent Living. My contact information will be on the final screen, and I encourage you to stop in, call, or email me if there's anything that I can do to assist you. During our time together, we'll be focusing on three main topics: medical emergency training, HIPAA privacy practices, and employee wellness. When we talk about medical emergencies, much of what we do is consistent across our campus and between departments. However, we do have some members of our team with specialized training. Please raise your hand if you are a nurse, a CNA, an RA or resident assistant, a member of the fitness team, or a security officer. If you have one of those positions, as you know, you are required to have CPR certification. CPR cards have to be renewed every 2 years. Be sure to put your due date on your calendar so you can keep track of when it is due to be renewed. There are times when a CPR class is offered on campus, so check with HR if you're getting close to your due date to see if there's one on the schedule. If you need assistance in finding a place to get your CPR renewed, don't hesitate to talk to your supervisor, HR, or me. The cost to get your CPR renewed is your responsibility. Be sure to send a copy of your renewed CPR card to your supervisor so it can be sent to your file in HR. But even though we have these great trained professionals in our building, we feel it's important for everyone to have knowledge of what to do in the event of a medical emergency. As we talk about medical emergencies, don't forget that medical emergencies don't only happen to our residents or patients. They could happen to a coworker, or a visitor, or a vendor. So it's good to be prepared to know what to do in case an emergency occurs. We teach our employees and our residents hands-only CPR, which is a simple way developed by the American Heart Association to provide support while waiting for the paramedics to come. Please note, if you are required to have CPR certification as part of your job description, you are expected to do full CPR, including rescue breathing. What should you do if you find someone who is unconscious or unresponsive? The first step is to call 911 right away. Our paramedic team is very close by and comes quickly. The sooner you call, the faster they come. The second step is to push hard and fast in the center of the chest to the beat of the classic disco song, Staying Alive. Keep performing chest compressions until help arrives. To review, there are 2 steps to hands-only CPR. The first is to call 911, and the second is to push hard and fast in the center of the chest until help arrives. We have multiple AEDs on campus. An AED, otherwise known as a defibrillator, is an important tool in cardiac emergencies. An AED works by analyzing the person's heart rhythm to see if an electric shock could help it work correctly again. I relate this to a common situation when someone's computer stops working right. Usually, if you turn it off and back on again, the computer starts working correctly. The same holds true with the AED. The hope is that a shock to the heart will help it reboot itself. If you find someone unresponsive or unconscious, get an AED right away or send somebody nearby to get it. Sometimes people are scared to use the AED in case it's done incorrectly. But to reassure you, no human decision making is needed. You cannot use the AED incorrectly. Our defibrillators are simple to use. The only thing you have to remember is how to turn it on. The round green button is the on button, and once it's pushed, the AED will start talking to you and showing you directions on its computer screen. Step 1 is to turn on the AED by pressing the on button. Step 2 is to place the pads on the person as directed by the AED's voice and screen. Step 3 is to administer a shock if the AED determines that a shock is needed. If a shock is needed, the machine will prompt you to stand back and don't touch the patient. This is important so you don't receive a shock also. Continue to follow the directions on the AED. If needed, the AED will talk you through the steps of hands-only CPR. We have AEDs located all around campus. At Windscape, we have one by the first and the second floor nurses station. At Westbridge, we have one in the first floor RA office and one in the second floor nurse's office. If you are an RA and you come to Wyndemere to answer an emergency call, we do ask that you bring a defibrillator along with you. At Wyndemere, we have AEDs on each floor, one on the ground floor by the coat closet outside the dining room, one on the first floor by the mailroom, on the second floor by the center elevator, and the third floor by the center elevator. Now that you know that we have these on campus, look around where you work to find the closest one. If you work in independent living, there are 2 policies for you to know about. These do not apply to Westbridge Assisted Living or to Windscape Health Center. If you are in the position of getting ready to do CPR or use an AED for somebody in Wyndemere Independent Living, take a moment first to check for a medic alert bracelet that reads DNR or Do Not Resuscitate. If a resident is wearing one, that means they do not want CPR or the AED used. If you don't see a bracelet, go ahead and get started. The second policy that is important for independent living is our no lift policy. That means if a person is on the ground and cannot get up on their own, staff are not allowed to help them up. In Westbridge and Windscape, there are trained professionals and equipment available to assess and help people up from the ground. But we don't have that support in independent living. For the resident safety and for yours, we require employees to call 911 for paramedic assistance. Being ready to support someone who is choking is also important on our campus. As people age, they are more at risk for choking due to muscle loss and other issues. If someone is choking, oftentimes they will hold their throat, which is considered the universal sign of choking. Other signs that someone is choking is that they cannot breathe, speak, or cough. If this is happening, call 911 and then take steps to perform the Heimlich maneuver. It is important to remember that if a victim can breathe, cough, or speak, do not interfere. But if the victim cannot breathe, cough, or speak, give quick upward thrusts. Stand behind the victim, place your arms around the victim's waist, make a fist and place the thumb side of the fist against the victim's mid-abdomen, above the waist but below the ribs. Avoid pressing on the bottom of the breastbone. Grab the fist with your other hand and give a quick upward thrust into the abdomen. Repeat until the stuck object pops out or until the victim becomes unconscious. If the person becomes unconscious, carefully lower the person to the ground and begin CPR. Make sure 911 has been called. We hope that everyone stays as safe as possible at work. You will hear a lot about safety from our safety committee, but sometimes things outside our control happen and you might find yourself in a position of needing first aid while at work. I encourage you to find a nurse to ask for assistance. Residential health is available to assist you as well. If you need first aid supplies for your workstation and you don't have what you need, reach out to me so I can help you get what's necessary. If you have any additional questions about emergency procedures, please reach out to me or talk to your supervisor. We will now spend some time talking about HIPAA and how we all need to work together to protect the privacy of the health information for our residents. HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. It is a law that requires all healthcare providers to promise the privacy, confidentiality, and security of the health information of every person. Patients have the right to this. What is protected health information, or otherwise known as PHI? PHI is any information in a medical record that can be used to identify an individual, and that was created, used, or disclosed in the course of providing a healthcare service. This information could include names, phone numbers, date of births, social security numbers, insurance information, diagnoses, billing information, or any individually identifiable health information. We need to work to protect this information to maintain our residents' privacy. Tips for privacy and security. We will be talking over the next few slides about things that you need to be aware of to help protect our residents' privacy and security. If you have any questions or if you think a HIPAA breach has occurred, talk to your supervisor or contact me. I'm the privacy officer of the campus, and on the last slide of this presentation you will see my contact information, but it's also listed here. My phone number is 630-681-4037. Social media is an opportunity to have HIPAA breaches, and we want to make sure that everybody is as aware as possible of the measures that they can do to prevent a HIPAA breach from happening. Here are some recommendations. Keep personal social media accounts separate from work accounts. Avoid friending residents or patients. Do not take a photo of a patient on a personal phone. Hide all patient identifiers during events where pictures are being taken, such as parties. Photos of workplace events can only be posted with permission from administration. If you see something posted on social media that you think could be a breach, be sure to reach out to your supervisor or to me. Other tips to maintain the privacy and security of our patients' health information are the following. Keep office doors closed when you are out. Turn documents with health information face down when not in use. Take protected documents to the shred box on a regular basis. Log off of your computer when stepping away. Never write down your password, and don't share your password with others. Be sure to use caution in opening email files from unknown sources, and double check email addresses and faxes before sending. Limit access to private health information on a need-to-know basis. Just because somebody asks for the information does not mean that they should get it. Residents often will ask about other residents wanting information about their health status, and we are not in a position to be able to give them any health information whatsoever. Sometimes employees also ask about residents' personal health information, and unless they are providing direct patient care, they do not have a reason to have that information, and we need to keep that health information private. Think before you speak. Do not conduct discussion in elevators, waiting areas, or other public places. Get patients permission before discussing care if there's someone else present with them. And keep voices down when discussing health information with someone directly or if you're talking on the phone. The final part of our talk will be about employee wellness and health support. Residential Health Services is here to support you with any health or wellness related issues that you might have. Everyone will be given a pamphlet of information from our office that lists our contact information on the front page, along with the things that we can do to support our employees. Inside the packet has information about guidelines, when to stay home if you are sick. Sometimes it's hard to know when you're ill if you should come into work or if you should stay home. So hopefully that information will give you some guidelines. The third page of the brochure talks about some self-care techniques when you have common illnesses like cold or the flu or a GI virus, and when to call your doctor. And the last page is about cold and flu prevention. We're very interested here in stopping the spread of infection, and we're going to count on you to help protect our residents and our employees and yourself by watching out to do everything that you can to prevent getting the flu or a cold while you work here. So some things that residential health services can help you with: health and wellness counseling. Do you have questions? We have answers. Medical questions, health information, wellness coaching. If you have any questions about those topics, don't hesitate to come in and let us know. Wyndemere is a wonderful place to work, but it can be a stressful place to work. When you work with people in a healthcare setting, it can be a very stressful or emotional place to work, so we're here to support with that. Sometimes you need to look for ways to bring calm into your life. Sometimes you just need a hug or someone who listens. We're happy to be here for you in that regard. Just come on in and talk to us and let us know how we can support you. Blood pressure, weight, pulse, oxygen checks. We have employees that come in regularly for those assessments and vitals. We can check you, we can write down your results, and we can even forward the results to your physician if you would like us to do that. We can also assist you by helping to schedule an appointment at Residential Health for some of our practitioners. Our podiatrist comes in every week, and if you have any foot care needs, we're happy to schedule you to see him. We also have lab services that come in weekly. If your physician orders lab work for you, instead of taking time off of work to get that done, why don't you bring it over to us? We do blood work on Thursday mornings. As long as we can see the order and we have a copy of your insurance card, we can do that blood work for you here. So just reach out to us and let us know if you'd like us to get you on the schedule. We also have an audiologist that comes here, a hearing specialist. So if you have concerns about your hearing, you're welcome to talk with us and we'll assist you in making that appointment. Or you might need referrals to medical specialists and community resources that are outside of the community. So specialists like cardiology, dermatology, maybe you're interested in acupuncture or holistic treatments or massage, reach out to us and let us know and we will help you. And then finally, we do different kinds of wellness programming. Wellness programming is geared towards helping all of our employees understand how they can be as happy and healthy as they possibly can while they're at work and when they're at home. So we do this in different ways. Sometimes we'll have contests between the employees. Over on the left, you'll see that at one point we did Survivor Wyndemere, where we had the red tribe taking on the blue tribe. It was a 3-month challenge, and people learned all kinds of ways to increase and improve your wellness. We also have some challenges, sometimes combining the residents and the staff. So the chicken on the lower right-hand corner is a contest we had to challenge the residents and the employees to do as many wellness activities as they could in a month, while placing votes for which employee they wanted to see have to wear a chicken costume all day at work. So it worked out well. We had over 1,800 votes that came in, and we all had a great time bonding together and learning how to improve our wellness. We also realize that you're at work sometimes more than you are at home, and it's important to build friendships and to have some fun at work. So you'll see some events that are geared towards that. We have Family Feud that happens occasionally with different departments taking on other departments. Sometimes we have a Minute to Win It game. Lately, we've been having exercise classes for the employees or a yoga class on a Friday afternoon. So keep your eyes on the plume and on bulletin boards and your e-blasts to hear about events that are coming up. Flu shots are highly recommended at Wyndemere. They are mandatory for anybody working at Windscape. So that's important for everybody to realize that if you work at Windscape, you will be reminded by your supervisor when flu shots are due, and we do give those out for free for any employee that wants one. At Westbridge and at Wyndemere, flu shots are not mandatory, but they're strongly encouraged. We have a lot of people that are in and out of the hospital. They bring back flu to our community, and it makes it that you are high at risk for getting the flu, and you're also at risk for bringing flu home to your family and passing flu to other coworkers and to our residents. So that is why we strongly encourage everybody to get the flu shot. If you have any questions or any concerns, don't hesitate to reach out to me or to any of your supervisors. TB tests are mandatory for Windscape and Westbridge employees annually. You will be notified when your TB test is due next by your supervisor. If you work at Wyndemere Independent Living only and you don't work at Windscape or Westbridge, you are not required to have an annual TB test. That's it for me. Again, welcome to our team. I'm very glad that you're here. Please reach out to me if I can assist you in any way. Again, this is Beth Gregg. I'm at Residential Health Services, which is located in Independent Living at Wyndemere across from the Beauty Salon and the Bistro. My phone number is 630-681-4037. You can reach me by email also at gregbeth@windemerelcs.com. Welcome to the team. We're glad to have you here, and I look forward to seeing you around our campus.